Where the endometriosis surgery fails is when it's abandoned due to unexpected complexity. If you're alone and you're a gynecologist, yes, you can be like a super gynecologist and train to do everything yourself, but that's rare. I'm trained to do bowel resections. I am trained to do ureterical implants, but I'm not doing those because I think that to protect the patient and protect the surgeon, you need a proper specialist to undertake a very specific part of surgery, but it should be done with the highest proficiency and highest responsibility for what we're doing as a team. And the team is something you can select. They not only have to be like great surgeons, but also they need to understand endometriosis. Because if you take a random colorectal surgeon, there's this colorectal guy is around, let me ask him to help me. And I've seen that happening, and that's a very wrong thing to do, because colorectal surgeon needs to meet the patient, needs to understand the patient, and we have like MDT discussion, discuss all the MRI scans and everything and CT scans as a team, and we formulate the strategy of surgery, and then we discuss it with the patient. If we cut corners like this, then inevitably we'll have either a surgical which is too radical, because colorectal resections for endometriosis have to be like economical. They're not cancer. We don't need to take huge part of the bowel, and we just need to remove what's really needed with the very narrow margins and avoid accessing the area which is full of nerves, because that can impair the function. We need to do a very, very economical, very specific type of bowel resection, which is very different from resection used in cancer surgery. Same with urology, For example, if we have a bladder infiltration, right, we don't need to remove the whole bladder. Like for cancer, sometimes it's the only way to go. For endometriosis, we just need to identify where the nodule starts and ends, remove that very part of the nodule, and then do a very economical resection, knowing this is not cancerous disease. That's why I really support the idea that a multi-organ involvement must be dealt with multidisciplinary team. If you identify a good person and a good surgeon, you can start introducing endometriosis concept to them, and most of them are good enough to understand it like quickly, straight away, and then they become a single mind with you, being endometriosis colorectal, endometriosis urologist, endometriosis hepatobiliary or thoracic surgeon. That doesn't diminish me as a gynecological surgeon, because I know my skills and I know my partner's skills as well. But I think it's the right thing to do for the patient, for the success of surgery. And as far as endometriosis surgery is concerned, I mean, for the completeness of excision where it is appropriate. Endometriosis is a specific disease which needs a very different mindset.